Hello again, Frontline. This is Val Soul back. I want to talk to you today about how HIV is transmitted. Here we have a picture of HIV, and we're going to learn about how this jerk gets into other people's bloodstreams and causes infections. So, the number one lesson is that HIV is hard to transmit. If it were as easy to transmit as all the myths say, we would all have HIV, and we don't. HIV is only transmitted in 4 body fluids: blood, semen, vaginal fluids, and breast milk. Now, if you were all in front of me, I would have you repeat these 4 with me, because it's crucial that you get these are the 4 fluids. You should know this like the back of your hand: blood, semen, vaginal fluids, and breast milk. HIV is only transmitted through those 4 body fluids. And HIV is not only transmitted in those 4 body fluids, but one of those body fluids actually has to get into someone else's bloodstream. And someone else's bloodstream is not an easy place to get to, because HIV does not pass through unbroken skin. Our skin is our biggest immune organ, and it does a really good job of keeping out germs 24 hours a day. That's one of the primary things that it does. HIV can get into the bloodstream when the skin, for whatever reason, doesn't stop HIV. So, primarily, we're looking at direct blood-to-blood contact, and the sharing of needles or razors, things that go directly from one bloodstream into another, that bypass the skin. HIV can also get into the bloodstream through open cuts, sores, or lesions. So we have here a kid crying with a cut knee. The third way that HIV can get into the bloodstream is through soft mucosal membranes. The key word here is mucus. They're places that in the body that are like skin, but they're not as tough. They're not exposed to the exterior in the same way. So here's an image showing you some mucosal membranes. We're talking about the vaginal and anal walls, the inner cheek walls, the tonsils. We could also put the sort of other mucosal membranes in the body that are less likely to be exposed to blood, semen, vaginal fluids, or breast milk. Would include the area up the nose or on the inside of the eyelid. Those are also mucosal membranes, but it's less likely that they're going to come into contact with the 4 fluids. So these are the questions that we want to ask ourselves about transmission. 1. What body fluid is involved? So if the body fluid that's involved is saliva, it's not going to transmit HIV, no matter what people say. The second question is, how would it get into the bloodstream? So even if there's a big puddle of blood that I put my hand in, if my hand doesn't have any open cuts, sores, or lesions, it's not direct blood-to-blood contact, and it's not mucosal membrane, HIV is not going to pass through that unbroken skin. So we want to know, how is it going to get into the bloodstream? And then thirdly, we want to figure out, well, how do we avoid that if we do know that that's going to happen? So, avoiding transmission. Abstinence is effective when we're talking about avoiding transmission, both abstaining from sex and abstaining from substances that affect decision making. That's definitely effective, but it's not particularly realistic. Many people don't abstain, nor should they. Sex is great. Pleasure is good for you. And people use drugs for a variety of reasons, some of which are beneficial. There are ways that we can protect ourselves even if we don't abstain from sex. There are ways that we can protect each other even if we don't abstain from sex or from drugs that affects decision making. So here we're going to talk in the second half of this presentation about those techniques. So there are a lot of different ways to be exposed to these fluids, and there are a lot of different levels of exposure. Not all exposures are the same. And there are many different ways to keep yourself safer. and this is known as harm reduction. Harm reduction is a philosophy that this is the international sign for syringe exchange, which is a really common form of harm reduction. But harm reduction is a philosophy where we look at the risk that someone faces, and then instead of saying, okay, well, you face a risk because you inject drugs and you share the needles that you use to inject drugs, so why don't you just abstain from drugs and stop shooting them and stop sharing those needles. If somebody's not ready to quit using drugs altogether, we can still break the behavior up into little pieces and change one piece of it that's going to affect the risks that someone faces and keep them safer, especially if someone isn't ready to stop the behavior overall. So, blood contact, as I said, has the highest risk for transmitting HIV. And there's kind of three main ways that we're talking about here. Needles, like this image. Needles either shared or just kind of found on the street. The best thing is to use a clean needle every time. If you reuse needles, they can be cleaned with bleach and rinsed well with water. And accidental needle sticks do not need to cause a transmission. There's a procedure known as post-exposure prophylaxis, whose whole job it is to keep someone who may have been exposed from HIV by an accidental needle stick from having a chronic HIV infection. We actually kick HIV's butt before it causes a chronic infection. But we'll be talking more about that in the future. I also just want to say that there are a lot of opponents of needle exchange programs, but the whole point of needle exchange programs is to get needles off of the streets, to give them safe places where they can go and be recycled instead of reused. So there's also a risk during first aid of blood contact, and here we have some people performing a medical procedure. Everybody trained in first aid should be trained in what are called universal precautions. The idea of universal precautions is that you don't need to know. If you're going to give mouth to somebody and their mouth is bloody, you don't need to know if they're HIV positive or not, because we assume universally that all blood has pathogens in it, has germs in it, and we respond accordingly. So we don't need to know if someone's positive. We assume they are, and we can still do first aid techniques on them. There's also a risk of blood transmission in birth. And here's an image of a newborn. The birth canal is a bloody place, and many infants can be infected during birth, but we can reduce that risk too, and that's something else that we're going to be talking about throughout this lesson. I'm going to go to part 2 of HIV transmission now, and where we'll be talking about having safer sex and ways that you can protect yourself through HIV transmission. I'll see you then.